Welcome and thank you for joining us for today's National Alzheimer's and Dementia Resource Center webinar series, sponsored by the Administration for Community Living and hosted by the American Society on Aging. We will be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you will find information on how to obtain CE credit for this event. You will have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logging in directly to this webinar, that is, if you are watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you would like to receive continuing education credit, please be sure you log in using your confirmation URL you received after individually registering. If you have questions during the presentation, you can send those anytime using the questions box, and we will save those for the last 10 to 15 minutes of today's program. And now I would like to welcome Siri Schumann with National Alzheimer's and Dementia Resource Center.
Thank you so much, Jen. Thanks everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Exploring Male Caregiving for People Living with Dementia. The National Alzheimer's and Dementia Resource Center series is supported by the Administration for Community Living. Before we start, Erin Long of ACL will provide a brief welcome. Erin?
Hi everyone. I just want to take this minute to thank you for taking time out of your busy days and schedules to listen in on this very, very important topic. I want to thank Dr. Molly Perdue and Mr. Bob O'Brien for their generosity in sharing what they know about male caregiving with the rest of us. With that, I will send you back to Sari so we can get started. Thanks, Sari.
Thank you. So as you heard, today's presenters are Dr. Molly Perdue and Mr. Bob O'Brien. Dr. Molly Perdue is co-founder and executive director of the Alzheimer's Family Support Center of Cape Cod. A former Division I basketball coach, Molly's care for her mother at home for 8 years was the catalyst for her research into Alzheimer's disease and dementia caregiving, and ultimately for the creation of the Alzheimer's Family Support Center of Cape Cod. She has worked with hundreds of families and individuals navigating dementia diseases. Along with her clinical work, Molly also serves as an educator and consultant in the areas of cognitive health, Alzheimer's disease, and dementia behavior management and family caregiving. Mr. Bob O'Brien joins us today and will be speaking about his experience as a caregiver for his wife of 52 years. In 2014, Mr. O'Brien retired from the Merchant Marine to care for his wife, Anne Marie, who had Alzheimer's disease. At this time, I'll turn things over to Dr. Molly Perdue and Mr. Bob O'Brien for their presentations. Molly? You can start whenever you're ready. If you're on mute, you can just unmute your phone.
Thank you, Siri. I want to thank you guys for inviting me to do such an interesting webinar on male caregiving. I want to thank the ASA. I want to thank the Dementia Resource Center and the Administration of Community Living for inviting Bob and myself to talk about such an important topic. I think before I get started, I'd also like to thank all of you out there that are listening today, that are getting CEs, that are working in the healthcare community, social workers, nurses, as well as direct care workers. During this time of COVID, all of you have been working extra hard, as we have at the Alzheimer's Family Support Center, and I just want to thank you all for the work you're doing. Our Alzheimer's families have had fewer resources, male and female, and so I just think you've done exceptional work out there in our communities and neighborhoods. So the next slide is really kind of introducing how I got into this work, and you gave me a great introduction, so I don't have to spend much time on this. But probably the most interesting thing about me was that when we were caring for my mom, I was actually writing my PhD dissertation. And, I would be sitting at my computer, and I would be looking at what the literature was out there, and then my mother would be looking out at Cape Cod Bay and asking why there was a woman swimming, which were buoys, And so learning how to do a lot of the pragmatic dementia care really has helped us kind of move into the next thing that we did do, and that was to ensure that the next group of caregivers would be able to get the support services necessary to help make their lives easier. And the two slides you saw in the previous, the two photos in the previous slide are my sons. And so they actually were able to live with my mother and were clearly two young boys learning what caregiving was about. So as far as male caregiving goes, I believe that there are going to be a lot of changes that will come down the pike because of the fact that our young people are becoming well educated on Alzheimer's. The rest of us, I would say, are pioneers in some way. So we try to do all sorts of support services. They're out there, and I think at some point looking at how these are going to help all caregivers be able to provide quality care in their own homes is clearly important. And some of the literature about male caregiving really talks to this idea of being able to have pragmatic solutions. And I think male caregivers are going to be able to kind of bring more of this into the conversation. So as we know, caregivers are not born with a dementia skill set. They have to acquire them. And this diverse set of skills is necessary to be able to navigate dementia successfully. That's as true for women as it is for men. And yet some of the challenges that males may face may be a little different than what many of our female caregivers are experiencing. So this is a timely issue, and it's great that we're looking into this right now. One of the things we know is there's going to be a tremendous need because all of the numbers are changing, and we're going to get into that in a second. But who are male caregivers? And male caregivers now make up about 40% of all caregivers, which equals for all diseases around 16 million males. The average age is around 48. Spousal caregivers tend to be a little older at 62, and when children are caring for parents, clearly that's a little younger at 46. It's a very diverse group. 59% are white, 13% black, 7% Asian, 10% Hispanic. When we look at married versus single, 56% of male caregivers are married, 26% are single, 11% are gay or transgendered or bisexual. Many male caregivers take the role out of necessity, which is very similar to female caregivers. And 23% of all these caregivers are caring for someone that has Alzheimer's or dementia. The length of care is roughly, for parents, is around 4 years. For spouses, it's 5 years where people are providing care. There's a misperception out there that male caregivers are just really looking at taking care of the finances and not doing any of the personal care. And we're starting to recognize from some of the literature that that is not necessarily the case. What caregivers do is they handle, 76% handles finance, the majority, almost 100%, do the shopping, does the housework, preparing meals, dealing with transportation. Well over half, almost 60%, handle medical and nursing tasks, which can be quite stressful. Spousal caregivers that do medical and nursing tasks talk about the fact that their having worked in the workforce has not prepared them to do many of those tasks. And they admit to struggling with pain management, incontinence care, and trying to help people with special diets. It is mentioned in the literature that helping them with instruction is critical. It's critical to well-being. Because of the supports that we need to have out there, male caregivers do experience and report moderate stress. And they also report moderate to severe physical strain because of the fact that they're doing many of these tasks by themselves without care. So looking at dementia in our communities, we know that dementia is a growing concern. The aging population is that presently 7,000 to 10,000 seniors are turning 65 every day in the United States. That accounts for about 48 million people. That's going to increase, almost double, not quite, by 2050. More than 5 million Americans are living with Alzheimer's or dementia, and that's about 1 in 10 in the 65-plus population. So this accounts for roughly 16 million dementia caregivers. We know 40%, you've already mentioned that, are male. And by mid-century, that number is going to triple. There is a need within our workforce to find these direct care workers and to have people working in healthcare occupations. It's one of the 5 top growth job markets in the country right now. So we know that more men are stepping up into this role. We know that they're doing it because they need to. And what we're doing next, which I thought would be very interesting, is we reached out to our caregivers. We sent out an email. We asked if any male caregivers were willing to kind of get in and weigh in on this topic. And we did a video that took about an hour and a half of having over 20 caregivers talk about what they're doing. We excerpt a few for today. And so now I want you to hear from some of the AFSC male caregivers and what their opinions are on things.
I can weigh in. My name's Mark Watson, and I've been caring for someone for 6 years who had early onset at age, I noticed at age 50, but it was certainly, there were symptoms previous. And there are no other issues other than Alzheimer's. And I guess 2 things I want to say about being a male caregiver is I suppose as men there are support networks. They're not as emotionally developed as many women who may have more robust friendship networks. Mm. So when you're in this role, you have to quickly build that because there's a lot of support that you need, and you may not have developed those muscles, for most of you. So that's one piece, at least from my own perspective. The second piece is I feel that Alzheimer's is swept under the carpet, and my partner is in his 50s, so everybody else is peers are still part of the fabric of social life. And so going to a restaurant or going out in public, et cetera, the world is not socialized to handle dementia because you can't see it. So all the hijinks of talking to the waiter before you sit at the table and all the crazy things that all of us do, there should be some campaign that this is does not happen in an assisted living context. Mm. People are out with dementia living in the world, and we have no real program to educate not just about the disease, but how do you relate to someone who has dementia.
Ken?
Okay, my name is Ken Green. I'm from Hanover, Massachusetts, and my wife was diagnosed at age 85 with Alzheimer's about 18 months ago. She passed away this past November of an illness unrelated to Alzheimer's, but I just wanted to pass on some of my experiences. And first of all, I want to answer your question. Is male participation a novelty? No, no, no. I feel very strong about that.
Carol got further and further into it. We became more and more isolated from other people, and that was rough. And even to the point now where I haven't really regained in touch because of COVID and the issues with that. So I'm hoping that next year my mental state will improve because I've been out with more different people.
One of the first things I learned in the group settings was we all get angry, and it's natural. we all get frustrated and we all get tired. So it's a natural happening, but we just have to step away and direct the anger somewhere else. Take a walk, or and get someone in to help at the home. But that's a natural thing. We all get angry.
Thank you for having us. My name is Christopher, and I take care of both my mother and my father. My father, they're both 87. My father has Alzheimer's and Parkinson's. My mother has mild cognitive impairment and some heart disease. So I did take a look at the questions, and I think that, and Molly, you must get this all the time, just people completely overwhelmed and horrified with, their new reality. And I think that for most things, I think education is so important. I'm educating, after handling, my parents' finances and making sure that everything is taken care of for any eventuality. I find myself educating myself more about long-term care insurance and hybrids for long-term care versus life insurance. And I think that we as a society, we've done a really good job of, socializing and working on 401k savings, but not on preparing for this stage of life.
But so today is one of those days. And you were just talking about shadowing, and I mean, Gail's getting to the point where I can't go any place. She has to know where I am 110% of the time. Even if you get up in the morning and get her pajamas off and get her in the shower, I mean, the words are, "Where are you?" I hear those probably 20,000 times a day. As far as male caregivers go, I think that from what I could tell, the difference between female and male is females have more compassion, and they've learned that as they've gotten older. Males have a tendency to, I'm going to do it on my own, more of a lone wolf type approach to stuff. And I think the females might have a better approach than we do. And I mean, it's frustrating. In fact, I just got a phone call this morning from a Naval Academy classmate who lives out in Portland, Oregon, and his wife has Alzheimer's. So we were talking. Gail interrupted us about 4 times, and he just says, you're about a year and a half behind me, and which is probably true.
A loss of hope, a loss of. I felt lonely. I think loneliness. I felt lonely. I had no place to turn. I could always take care of everything we needed to do and take care of Helen. But suddenly I find there's something here I don't know anything about, and no one can explain it to me that makes me feel better until I discovered Alzheimer's Family Support and Molly. When Molly first came and started to make me understand that there's no hope, but there are other people in the same boat. And that makes you feel much less lonely when you know other people are there.
Large, it had been, my experience had been, and my perception had been, it's women that come in looking for help. And, it's been such an honor for me to be able to work with some of the men. I believe there's, we could spend all day talking about it. I think there's a plethora of sociological issues, and some of you have touched on those in here. Why we're different. Things are different for us as men, as caregivers, than they are for women. I think a lot has to do with, as I said, the sociological and the upbringing that we get and so forth. And so we're relearning. And for that, I absolutely salute every one of you. And we're looking to see how we can make that grow. We talk about these types of issues in our groups many times. And, I think I also want to say, I think that a lot more research needs to be done on this. I was reading, and there was some time ago, there was this Forbes article. I said between 1996 and 2011, the percentage of men among adults caring for a family member with Alzheimer's or some other form of dementia more than doubled from 19% to 40%.
Okay, so thank you, Keith, for playing that. So the interesting thing about breaking stereotypes is that we have a lot to learn, men from women and women from men, and this happens a lot in our support groups. And Vaughn Harding, who had the last word on that video, he's our clinical director, and he runs some caregiver groups just for men. The rest of our groups are pretty much integrated, and we have a lot of male caregivers that do get involved with what we do, and I can say from my pragmatic experience is that they bring so much into the groups that they are integrated in. And there are some assumptions that we make about men being providers and protectors and problem solvers, and that is really positive. I think another real positive that male caregivers bring to the table, especially for adult children, is that they are caregiving, but they continue working. And we spend a lot of time trying to get people to think about how to have some distraction from caregiving so that they keep afloat in their own life. And I like how men do that in higher numbers than women do. Sometimes there are some difficulties around paid work being the value, but I think those values and those roles are changing. So gender differences, I brought in a research study that interviewed 335 couples. They used the Zaret burden scale, which I think most people are pretty familiar with. It tries to look at burden, caregiver burden, geriatric depression screen, and they looked at dementia scales in people that they were caring for. What was really interesting is that the men, when they scored the people they were caring for, they were in more severe stages of the disease, but they did not report as much difficulty with caring. Females did report on these scales, on the GDP, some depressive symptoms in higher numbers than some of the males. So what came out of some of this is that social participation and better health equal less caregiver burden. And that's true for the men as well as the women. And that caregivers with low levels of distress did use problem-solving strategies, acceptance, and coping skills. So in trying to understand male caregiver burden, men can face significant caregiver burden because they have less robust support systems. That seems to be established in some of the literature. There's not a lot of literature on this subject, but that is something that clearly needs to be further investigated. Or males are less likely to seek support. The financial burden is a little different. 56% of males make more than $50,000 a year, and as I just said, are more likely to work outside the home. So they may actually bring some better situated, they are better situated financially than some females. So what seems to impact caregiver burden is a strength of relationship for men. So how good and how strong is that relationship to the person that they are caring for? It will impact self-esteem, and it will impact their level of burden. Stress can be very significant for male caregivers. And sometimes this can be underrepresented in the data because they may not talk as freely about their feelings. And this is something that comes out through some modeling in support groups when there's a mixed group. One of the difficulties that many male caregivers report is with personal care needs and not understanding exactly how to deal with the medical and the personal care. And so trainings could be very important, and we'll talk about that, when we get it to some recommendations. But men may be less likely to access support systems, and what we see is not so much adult children, but in spousal males, it may take some time for them to be able to connect to support systems. So taking women's work like a man, it's interesting. It wasn't a large cohort. It was actually a fairly small study, 22 people, 9 husbands. But what they investigated was how men kind of were able to deal with caregiving work. And they found these 6 coping strategies that most of these 9 husbands, so it's not a very large sample size, employed. Exerting force, and this is something that comes up sometimes in groups. You know, you have to take the shower, and sometimes that works. Focusing on tasks, blocking emotions, some of them are not so positive, minimizing disruptions, in other words, staying focused, distracting attention, and sometimes, unfortunately, they're self-medicating, and that happens within the whole caregiving population. It's an area of concern to kind of deal with the stress and many of the depressive symptoms and anxiety that also goes hand in hand with male and female caregiving. Something that does come up a lot is this idea of emotional and psychological burden. And this is something that we might find really needs to be addressed because what's interesting about what Sanders did, and this is a study that was done way back in 2002, but it's seminal work, was looking at 71 male caregivers that they had brought in to be interviewed from a local Alzheimer's association and kind of see what are some of the things that male caregivers went through. And, you know, I want you to think about grief as a reaction to the perception of loss. And loss, sadness, and grief and depression sometimes accompany many, many caregivers. It is believed, and this is something that would probably need to be investigated as well, is that the stronger the attachment, the stronger the feelings of loss. And because someone is feeling loss, how they're dealing with that can contribute to the level of grief that they experience. And we talk a lot with caregivers about it, this ambiguous loss, this anticipatory grief, because you're watching someone that you're caring for slowly diminish before your eyes. We work with a man, Greg O'Brien, who's living with Alzheimer's, and he calls it a death a day when he refers to his own cognitive loss. And I think, although you know that sounds a little dramatic, I think for caregivers that are witnessing some of these losses, finding ways to improve skills for dealing with those feelings can be very, very important, especially to male caregivers. When we start to look at reports of depression, it may be that men may just report fewer feelings. It doesn't necessarily mean that they may not be experiencing some of them. There was one study that we looked at male caregivers versus a non-caregiving group of men, and what they found was that the caregivers did report more depressed feelings. So it's possible we may be looking, you know, apples to oranges here, and really there needs to be further investigation because all of these issues we can do something about by providing support services. So some of the differences, providing care at all costs is something that came up with these male caregivers, being a little more duty-driven. They may not be comfortable sharing all their feelings of pain and loss, or just may not be socialized in doing so. Isolation gets reported as a component of caregiving, of Alzheimer's caregiving. And this isolation for males can sometimes decline after a death of a spouse, but many times the spouse is responsible for the socialization. So they were the person that got everyone together, and then when the spouse starts going through the symptoms of dementia, the whole socialization piece doesn't find a way to get answered. So many times, even within our support groups, we find that people start to make some of these social connections that are really life-changing. So within this work, some of the losses that these male caregivers experienced, 69% talked about experiencing a loss of intimacy, 67% loss of activity, loss of relationship is very big, loss of social interaction that I was just talking about, loss of physical health. Something that has come out of some of these studies that have looked at male caregivers is that they may have more comorbidities, they may have more health issues than their female counterparts. There's a loss, 25% report a loss of mental health. The same amount report a loss of friends. And a very small amount talk about a loss of self. And some of the, I would say, abstract ideas that we don't really talk about is this sense of purpose that people experience when they're caregiving and having meaning in their life, which can be so very important. So if it were just the stress of caregiving and these emotional strains did not play a big piece, we would find a little different information post-placement. So when a person gets to a point, a caregiver gets to a point of needing to place the person they're caring for, this can give them a reduction in their actual care hours. It can give them a reduction in all the physical strain that they were encountering. But what we find is it can be a trade-off to some extent, and that male caregivers can report some depressive symptoms, possibly due to feelings of failure, betrayal, like dereliction of duty. And so what's important about this information about male caregivers is that we need to start thinking about how we're going to reframe some of these really important issues. Probably the most interesting way I had a male caregiver in one of my groups talk about this was that he said to a group of about 28 people that he realized that if he continued to care for his wife at home, that he was doing her a disservice because her care was bigger than anything he could provide at that point. And that story has become a very important framework for helping people think into what they're going to do next. So many, many considerations for what we're going to do to try and help people kind of think into the future. And one of the issues that we have here, and Vaughn Harding, who was in that video, talked about male or female, lose the pride and seek help early, which I think is great advice. You know, we know from the literature that people that connect to services earlier in their caregiving journey, they tend to do better. They have better health outcomes, higher quality of life. We learned a lot of this from New York University's caregiver counseling studies we were able to participate in. And we were able to connect people and create this social safety net. And we found that people that actually did that, and the literature out of NYU has shown they fare better. So I think this is really important, is for us to help our people connect. We need more evidence-based research on male caregivers, so we can really look into all the great things that are brought to the table and the things that we need to focus on within our clinical areas and within our support services. One of the things that many men talk about is this increased educational need, especially around issues of personal hygiene and personal care. We need classes that are readily available to help with instruction, especially if men are problem solvers and they're going to look at it where, give me the information and I'm going to be able to kind of put it into operation. And along with that, I talk about this pragmatic framework for managing neuropsychiatric symptoms. And we know that people with dementia, anywhere between, I would say, 80% of folks may have some type of neuropsychiatric symptoms, sleeplessness, aggression, any of these neuropsychiatric wanderings, certain things that people can be trained to understand how to deal with. And understanding, what do you do when your wife or your mother wants to go home every night, and having some pragmatic solutions and some real robust discussion about how to help people with these neuropsychiatric symptoms can be so helpful to male caregivers as well as female. Training around how to understand long-term care planning, really important. We have on our staff a trained shine worker, which I think is critical because so many people have questions on how to connect to the financial resources. And one of the issues that we know is happening for folks is they're not connecting. In one of the studies, it was something like only 28% of male caregivers connected to any type of financial help or so getting people to understand that there are some things out there that they may qualify for, is so important to people's well-being. Having conversations about when it's time for placement, very, very important. Another thing that comes up in the literature is a lack of utilization of respite services. In other words, getting caregivers to take a break. It's so critical. And a lot of this is underrepresented within male caregiving, especially spouses. Spousal males have a hard time connecting to help. And I believe that is something that, we can readily work on changing so that everybody gets the help that they need. And easily accessed support services, many people don't know they're out there. We find in our own communities, word of mouth ends up connecting so many people to these things. So I think challenging the caregiving as a problem to be solved mentality, and that it is bigger than one person and that we're all in this together, and making our connection to services as easily as a phone call or an email is going to be really critical to the future of caregiving. And we know that it is critical that we provide these supports because people really need them. We can help people's well-being that are taking this very, very important jobs with the people that they love, with their families, their friends even. One of the male caregivers that you didn't hear today, he was taking care of a friend. So I can tell you that, we're kind of on the front lines as well, and we're going to continue to help everybody. And it's my pleasure to have one of our caregivers, Bob O'Brien, who is going to be up next talking about his experiences. So, Bob?
Okay, that's my cue. Thank you, Molly. I appreciate it. I appreciate the opportunity to talk about my caregiving experience with my lovely wife, Anne Marie. She had Alzheimer's for about 9 years, so it was a long journey. Friends and family called her Mimi, and she also had a nickname of Hollywood, and that came about my daughter Christine and her friends called Anne Marie Hollywood because her hair was always so perfect, her makeup was just so, always had her nails done, and she always had her bling on, so she was certainly a Hollywood type person. We rolled that theme of Hollywood into Team Hollywood, and we participated in the Walk for a Cure with the Alzheimer's Association for 4 years. And we raised about $12,000 each of those 4 years, so it was at least something we could do with a situation, really, that there isn't any hope. Last year, I talked with Molly and Melanie about switching over to the Alzheimer's Family Support Center because at that point, I thought the work that they were doing was so instrumental in the success of caregivers that we should devote our caregiving to that endeavor, which we did last year. In fact, Molly and Melanie developed a video which incorporated our 3 children and our 8 grandchildren. They all made a presentation, and there were several videos and photos. It's actually, it was very professional, and we used that in our efforts for raising money for the Alzheimer's Family Support Center. And I believe that's on their website as well. On a personal note, Anne Marie and I met as seniors in high school, so it was a long relationship, that's for sure. Back in those days, you could go into any school without having to have credentials. I guess you can't do it now, but in any case, I went over to her high school quite a bit and had lunch with her, so that was pretty cool. Anne Marie passed away on September 3rd last year, which of course was heartbreaking. But on a personal note, Anne Marie doesn't have Alzheimer's anymore, and that was very important to me. As mentioned before, I was in the merchant marine and sailed for 20 years and went away to sea. And the important part about that is that Anne Marie ran the ship at home during that time, and she did an excellent job, a super mom for sure. The area that we lived had over 50 children, and so in those days, pretty much every woman in the neighborhood was working, so Anne Marie was kind of the captain of the neighborhood. Guess who took care of the doctor's appointments, the dentist, pick up the kids at school. In the summertime, she brought all the kids to the beach in the van that we had, so that was, she was really a super mom in that respect. One of the unusual things, I was on a super tanker running between Valdez, Alaska and Panama. And back in those days, they didn't have the communications that they have nowadays. They didn't have the satellite phones or the satellite communications and so forth. And that ship was at sea nearly all the time, a 30-day round trip from Valdez, Alaska to the Panama Canal. But in any case, Anne Marie agreed that we, to get licensed as amateur radio operators, which we did. We had an amateur station on the ship, and the captain and the chief and the radio operator was a ham. I was the chief engineer on that vessel, and we communicated in the early days when Anne Marie first got licensed. By Morse code, so that was unusual. For 18 months, we communicated on schedule from that ship back to our home in Randolph, Massachusetts by Morse code. So after about 18 months, Anne Marie got her voice license, so we could talk voice, so that was unusual. After I finished up at sea, I was a plant manager at large utility stations, and I worked a lot during those times. And as Molly had indicated, Anne Marie had all the social contacts that I had, being working so much and being away. So when we lost those social contacts, it was I just didn't have the connection that I needed to have. Because Anne Marie, she got Alzheimer's when she was about 65 years old. And one of the things to note, the primary care physicians were very, very kind, of course, but their drive was to try to find a medical solution to Anne Marie's problems, vitamin deficiency, depression, brain scan, that type of thing. And of course, that didn't work. In our discussions with caregivers, there's a lot of people talk about the neurologist, and many people say that they have not been helpful, but we did find a neurologist that was very helpful and assisted with medications for anxiety and depression and crying and that sort of thing. One of the things that hit me pretty hard when Anne Marie was at home, and she was basically nonverbal. She'd answer questions, but she didn't come up actually say anything too much on her own. But she came in to me and was whimpering a bit, and she said to me, and I asked her what was the matter, and she said, "I just want to be me." That kind of hit me hard at that time. It's almost a good name for a book or a movie. But in any case, with the caregiving at homes, I found we had an opportunity to be in a day program for about 18 months until she got too bad to be in that program, and that was a good break. And we did use some home health aides. Some were good, some not so good. I think you have to know when to change health aides if they're not working out for you. And one of the things that I've said to myself 100 times, if it never gets worse than this, I'll be okay. But it always gets worse than that. Some of the major issues that we had, we had a bathroom issue where she felt like she had to go all the time, and that was doesn't sound too bad, but it was really a nightmare because we couldn't really go anyplace. But after going through lots of tests, the neurologist found a medication that worked. It was like a miracle, really. And another issue that Anne-Marie had was crying. And as a result of her crying, she had several falls, ended up in the emergency room, which is a very difficult situation for an Alzheimer's patient. And we finally had to place her in a geri psych ward, and she was there for 5 weeks, which was really a nightmare. But the end result was that we were able to get that under control. The good news for us after the geri psych visit, we placed Anne-Marie at Harbor Point in Centerville, Mass, and that was a godsend because they really know how to take care of Alzheimer's patients. And the difference was it was kind of like going to grandmother's house and with all the love, as opposed to maybe going to a nice hotel or a hospital. So there is a difference in memory care facilities, that's for sure. And one of the things about Harbor Point, the transition to end of life was very peaceful. And one of the things that happened during that time, Anne-Marie was designated possibly to die in 2 or 3 days, but she poked along. But the weekend, she died on a Thursday. The weekend before she died, for some reason, all of a sudden she woke up, she talked to the grandchildren, she laughed, she sang, and she did that both Saturday and Sunday. And that was really a gift. And just in closing, my daughter Christine has been a partner with me in all of this. And you really do have to have a partner. In fact, Christine slept with Anne-Marie for 5 nights before she passed away, and that was very comforting. And I spent the days there. So I just want to say my caregiving experience has taught me that no one can provide the care needed in later stages of Alzheimer's without assistance. You have to have home health care, day programs, and if you can pull it, long-term care. And of course, support groups, they're essentially for the quality of care. And just kind of in closing, it is heartbreaking to see your loved one decline with Alzheimer's. But it was an honor to care for Anne-Marie, and she still has a presence in my life. Thank you.
Molly, do you want to close out, and then we'll go to questions?
Yeah, I want to thank Bob for all of his information. I think it's incredible. You know, he was an exceptional caregiver that kind of took on everything head on, and a real leader in his support group to other male caregivers. And I think being so forthcoming about his experiences, which he is, has kind of set the model in many of our support groups for other guys. And I think that providing these services that are readily available and helping people recognize what is out there is so critical to both male caregivers and females, but especially to our male caregivers, because with enough support that they can get the help they need when they need it, the caregiving experience can allow you to enjoy the time you have. And I think that is paramount to these support services being available in every neighborhood across the country, is that people actually do better, and there's a large body of evidence that shows that. And Bob is one of those caregivers. So, you know, I want to thank everybody for, you know, listening to us for this whole time. You know, I think that it's going to take all of us to continue to kind of move these conversations along. And I know I touched on just a few things, but you know, we didn't have a lot of time to go into depth, but maybe we'll have to do this again. So thank you guys for inviting us.
Well, thank you both, Molly and Bob, for your presentation today. Molly and Bob, for sharing the story of your life with Anne Marie. We do have questions coming in. If others have questions, you can feel free to enter them into the Q&A pod on the webinar platform. Not surprising to me, there are a few questions here asking about the how. How do you help a male caregiver accept outside services? It's interesting. There's just a few questions that echo this same chord of that it's hard to get a male caregiver in some instances to accept going to a support group or bringing someone inside the home to help. Do you have any suggestions you can offer?
I do, because so one of the things that we do is we try to have low-risk activities. So in other words, it's not as hard for a male caregiver to walk into a museum, say for an arts and ideas program, which could be learning how to conduct, singing, making pottery, I mean something for his wife. So we start by trying to attract people into services at a point in time they don't even think they're going to need them because they're not there yet. And that tends to be the thing that people will say when they do call, I'm not sure I need your services yet. So by having something like a chorus that maybe your wife would sing, at her church on Sunday, and, come down to the local COA, we've put together a chorus with children, that's something someone will do. So I think helping people connect early is about providing opportunities for the entire couple or for the caregiver and the person they're caring for. And that seems to be a pretty easy fix. And then once someone gets in that way, then they start to have this conversation as things start to change. And then they recognize, because there's a contact with an organization that knows, you could need help for 20 years. These things, they take time, and that's the silver lining. It gives you time with the people you love, but it's also the difficulty of being able to stay a step ahead. And one of the ways we're going to reduce the cost of caregiving is by supplying folks with this information before the crisis. And so when people start to get that information and they see that it's working in their own lives, you don't have to sell anything. It's clear that this is helping them. So I would say, attracting especially male spousal caregivers will be by having things where they come together. It's not just you, because this comes up a lot. What am I going to do with my wife, and how do I access help? But hey, you get her involved, and all of a sudden the caregiver may come along for services a little later. And we do that with support. So we have a volunteer program that attracts people in early stage, because we know there's a lot of purpose and there's a lot of meaning that they can still find in their lives. So, for example, our end of the year mailing, it was completely done by people living with dementia. Now, it was COVID, so it was very interesting to sort out all sorts of letters and, have to do it protecting HIPAA, but we did. And people found, just such joy in being able to be a part of something. We did a conference. We did a TIPA Snow conference that I would invite everyone here. I noticed there's going to be some questions maybe about how to do actual dementia care. We do a free conference every year that will teach you some of these skills and will help you kind of be able to do the next thing. Well, our first free conference, we had 1,400 people that we were going to bring together, and we had folders that had agendas, that had information from sponsors, and our dementia volunteers were able to stuff 1,400 folders. And then they came to the conference, and they were so proud of being a part of it and giving back, kind of like what Bob said about giving back. There's so many ways people can do that. So I think that, we have to take our creativity, we have to think about, well, what do people actually like to do? And how do we get people to do the things they like to do and get help at the same time? And, that is the conundrum of caregiving, having been one for 8 years, right? If we had to find, and we had to be able to be creative. So I would say that for all the people out there, that's kind of how you bring people in.
Great, thank you so much. You talked a lot about spousal caregiving. There's a few questions that have come in about how do we engage male caregivers who are sons and caring either for, for one of their parents or both of their parents. As we saw in the video, there was one gentleman who's caring for both parents. Can you talk a little bit about how to engage, especially they're asking about younger sons, like the under 30 age group. So any comments on that?
Yeah, absolutely. I know, it's like stump the panel. So one of the things we did to reach out to our adult children is you have to do evening groups. Like one thing, if people are working, and we know adult sons are still working, the statistics shows that, you have to be willing to have people go on or show up when we can get back into in-person and do these groups after 5 o'clock. And so by doing that, I run some late night groups. I have adult children that, go to work, maybe are even driving home and connect on the drive home and are able to talk about what's going on. And once again, if the information, so all of our support groups are run by trained dementia professionals, master's level clinicians, and so they're able to give really good support. And once you get a little help, once you realize, oh, my dad was a veteran, and there's an aid and attendance program that we might be able to connect to that might help us care in the home. And people just get sold on what the actual support does for them. Another thing is to be, and this is true for any diverse group of caregivers, is that you want to be inclusive. You want to create an atmosphere in all of these groups and all of these educational offerings that everybody gets to come to the table and be heard and be a part of it. And, the beauty of support groups is that everybody thinks everybody else in the group has it worse off than they do. And I can't tell you how many people the first time they come, this is what they tell me, oh, I feel like I'm so lucky, compared to the other guy or the other girl. And this happens. And so, helping an adult child not, be with people, somewhat in a similar age group. That's why we do these evening groups, which kind of just automatically filters in younger folks because it's late. That's helpful. Education is critical. People that are more pragmatic, they don't want to waste a lot of time, but they want to learn the facts. So we do evidence-based educational programs like the Savvy Caregiver and some other things. And we find that giving an adult child 12 hours of training, which is what you get in this Savvy educational program, is critical. It gives them a framework. And from there, they start to see, wow, I can do a little better in my caregiving, and then it just takes off from there.
Great, thank you so much. I don't think we have time for more questions. We've reached the end of our hour together. I do want to thank you again, Molly and Bob, for your presentations today. Very insightful. You have piles and piles of thank yous coming into the question and answer pod. So we appreciate everyone's attendance today as well at the National Alzheimer's and Dementia Resource Center webinar series. We would love for you to join us again on March 11th as we have a webinar on complex care management for people living with dementia. Registration information is available now on the ASA website. I'm going to turn it back to Jen Rivera for a moment for some final remarks and CE comments. And thank you all for coming today. Jen?
Yes, thank you. If you'd like to claim CEUs for today's webinar, you will be receiving a follow-up email by the end of the business day that will contain a link to the CEU application. That follow-up email will also contain a link to today's slides. Please note you have 60 days to claim CEUs for today's webinar, and please note it will take 30 days from the date of your submission in order for us to process and issue your CEUs. Thanks for joining us today, everyone.